This series of videos was designed to provide educational content for federally qualified health centers and rural health clinics to assist with their telehealth implementation. The content is also useful for other types of providers and organizations.
Good afternoon. Welcome to today's training video, which will focus on telehealth process improvement and program evaluation. Today, we're going to focus on measuring outcomes and indicators of success of your program. My name is Katy Cook, and I'm the owner of ADK Health Solutions. Let's dive right into what we'll discuss today. In today's video, we will examine the process for reviewing performance, identifying areas of improvement, and implementing changes to your telehealth program based on data, outcomes, and results. For telemedicine to be used successfully, it is necessary for there to be effective organization, reliable technology, adequate financing, regulations that support its use, and acceptance by providers and patients. Many healthcare organizations have existing process improvement efforts and program evaluation metrics in place that can easily transfer over to telehealth. So why is measuring outcomes and improving performance important? You think, your telehealth program is up and running, patients are enjoying the service, workflows are operating smoothly, the hard part must be over, right? Not exactly. Developing a performance monitoring plan for your telehealth program is an often overlooked step, but a necessary one to determine if you're successfully meeting certain objectives. Quality improvement of your telehealth program is necessary for optimal performance and both patient and provider satisfaction. So is your telehealth program helping to meet specific insurer, state, and/or federal quality measures? For example, federally qualified health centers and rural health clinics are required to report on clinical quality measures to the Uniform Data System, which is HRSA's Health Center Measure Set, which is a potential resource that state policymakers can consider when maximizing both state and clinic resources. An excerpt from the National Academy for State Health Policy states, FQHCs have the capacity to impact cost and quality for services provided directly by the FQHC, such as improving diabetes management, and for patient outcomes that involve the broader health system, such as reducing unnecessary emergency department utilization. States can help promote this accountability by selecting a diverse set of measures that includes primary care prevention and chronic care measures, as well as outcome measures that indicate improved care management and coordination, such as decreased emergency department utilization and inpatient readmissions. There are two sections that we will cover today: quality improvement process and program evaluation. Program evaluation will involve how and what you track or measure, and quality improvement is taking those measures and improving them to positively impact patient care. Program evaluation involves developing an approach to measure, track, and achieve targeted goals for your telehealth program. This involves identifying various data collection methods, what data will be obtained, and defining the overall impact telehealth has made in your organization. Continual assessment of access to clinical services, effectiveness of the technology, overall experience of receiving care through a virtual environment, and financial impact and cost of telehealth services ensure that various modalities of telehealth provide efficient and essential care. Encounters between a patient or family member and a provider or other healthcare professional through telehealth can enable the integration of telehealth services into a healthcare setting in a way that minimizes impact to workflow. An excerpt from the California Telehealth Resource Center's Telehealth Program Developer Kit reads, "The quality improvement process should provide written documentation on the manner in which the program will implement quality improvement. It should document the improvement structure, reviewing performance, submitting improvement suggestions, and monitoring implementation of those improvements." When reviewing your telehealth program, it is important to focus on several key areas to measure success as outlined on the slide, such as access to care, financial impact, patient and provider experience, and effectiveness of the intervention. Let's break these 4 areas down further. Starting with access to care. Is your telehealth program allowing individuals to obtain healthcare services easily? Is your program offering specialized services that would otherwise be difficult for patients to access? Access can mean different things to the patient or the provider. For the patient, it refers to the ability of accessing services from providers they otherwise would not be able to see due to barriers such as geographical distance, transportation or travel costs, limited mobility, time off of work, and more. Limited access can lead to underutilization of certain services or even lead to increased hospital use. For the provider or clinical team, access can mean having appropriate access to telehealth technologies. It can mean access to specific information through electronic health records, health information exchanges, or secure patient portals. Common data elements to measure in this area include telehealth services provided by total and type, percent of all healthcare encounters performed using telehealth, which will show overall utilization, or percent of scheduled telehealth encounters that were successfully completed and those that were not completed. This will show if there's an access issue on either side of the encounter related to technical concerns or limited bandwidth. Next, we'll look at financial impact and/or cost. Concrete data around financial impacts and cost of telehealth programs is still limited in overall literature. The financial impact of a telehealth program not only affects the practice implementing it, but it can affect the patient and even the payer. From a patient perspective, positive financial impact can be realized in reduced travel time or transportation costs to see a provider, less time lost at work or keeping children in daycare. Financial negative impact could occur if a patient does not have the appropriate technology to access a virtual appointment, such as no access to a computer, tablet, or smartphone, or the patient resides in an area with poor internet connectivity. From the provider or clinic perspective, financial impact can come from the direct costs of implementing a program and having to purchase hardware or software to see patients virtually, and opportunity costs realized in time spent training staff on the new workflows, or even etiquette when conducting a virtual visit. From the payer perspective, financial impact can be seen in revised reimbursement rates and manipulating claims processing systems to handle new telehealth codes or modifiers. Common data elements to measure in this area include estimated reduction or avoidance in travel cost. This can include total travel miles avoided by both patients and providers and could be further broken down by payer and service type. Carbon footprint impact. Take the above number of travel miles avoided and create an algorithm to determine the overall carbon footprint impact. Lastly, return on investment. This is a key measure that many health systems should be tracking. What is the revenue or gain from your investment in telehealth? What is the cost associated with this investment? When will you break even? Next, we'll look at patient and provider experience. This is an important measure to capture as it will highlight the perceived effectiveness of your telehealth program. Are you offering a level of care that is beneficial to your patients? Are both parties satisfied with the intervention? For patients and their families, their experience can be positively or negatively impacted by their ability to use technology. Was their visit completed with no interruption? Did the patient feel as if the quality of care they received was comparable to that of an in-person encounter? For the providers, their satisfaction is studied less frequently, but is a critical determinant of whether telemedicine will be used to see patients. Do they feel they're providing the same level of quality to their patients in a virtual setting? Is the practice involving their providers in the design of the program? Is the technology easy to use and reliable? Common data elements to measure in this area include percent of patients that indicate overall satisfaction levels, number of responses collected, could be done electronically at an in-person encounter, by telephone, or by mail. Percent of patients that indicated they would recommend telehealth to a friend or family member. And lastly, percent of providers that indicated overall satisfaction levels. Do they feel supported by executive level staff? Is there adequate training to provide ease of use? Are providers referring patients to virtual visits? Next, we'll look at the effectiveness of the telehealth intervention. Clinical effectiveness of a telehealth program is incredibly important to measure, as improved health outcomes through telehealth can lead to increased reimbursement rates, funding opportunities, and federal or state support if the outcomes are positive. Is the telehealth program decreasing rates of depression and anxiety in the patient population? Is overall emergency department use down because patients are receiving care before their issues escalate? From an operational perspective, how well integrated is the telehealth program into existing workflows? Is your electronic health record system successfully recording and transmitting data? Is care coordination happening across various settings? Are payer measures being more effectively met? Once you have defined your measures and how you plan to track them, either through the electronic health record, health information exchange data, or patient satisfaction surveys, you can dive deeper into the quality improvement process. In healthcare, quality improvement is the framework used to systematically improve the ways in which care is delivered to patients. A QI process has characteristics that can be measured, analyzed, improved, and controlled. It involves continuous efforts to achieve stable and predictable results and aims to reduce variation while improving the outcomes for both patients, providers, and the overall healthcare system. QI requires commitment from every level of the healthcare organization, and there are multiple methods that an organization can use, as identified on the slide. Lean Six Sigma is a methodology used in healthcare to improve performance by systematically removing waste. How can the use of telemedicine reduce waste in different parts of the delivery system? Using a swim lane diagram of the current delivery process can be helpful to identify specific areas where telemedicine can help eliminate non-value added cost and improve quality. SMART goals. SMART stands for specific, measurable, attainable, relevant, and time-bounded. Establishing SMART goals early in the implementation process can be helpful in articulating the overall goal of the project and defining the boundaries in which to measure and improve. Lastly, PDSA cycles. PDSA stands for Plan, Do, Study, Act. These cycles are a commonly used QI approach and test the effects of small changes, allow the organization to make the changes, and then spread them to other departments and service lines. QI teams then introduce and test changes designed to achieve the improvement aims using additional PDSA cycles until they arrive on a change they believe will produce the desired results and is ready for implementation and spread. As telehealth programs grow, continuous program monitoring is important to help identify potential points of improvement. Regular evaluation of your program allows the organization to identify areas of high and low performance and therefore make changes as needed. This information may be provided in data reports and patient satisfaction surveys. Once you have developed your evaluation plan, checklist of data elements you plan to measure, and a QI process is in place, it's important to consider the following questions on this slide prior to moving forward. Have you developed the right approach to measure, track, and achieve various data targets for telehealth? Have you developed a plan to measure success in achieving your program goals and outcomes? Have you determined how you will know what impact telehealth has made in your organization? Have you determined how you will collect data? If your program is not meeting performance objectives, what is your process for identifying and implementing change? And lastly, have you determined how the changes and improvements will be defined, implemented, tested, and managed? Evaluation is important for demonstrating the value of telehealth, which can be fundamental to justifying continued or expanded investment in telehealth infrastructure and program operations. Strategic planning is important from the start and helps telehealth programs develop plans for evaluations that capture metrics to help show value. Incorporating a robust evaluation plan and tracking the right measures can help you to show success and build a business case for the future. Thoughtful evaluation plans can also help programs sustain or expand over time. On the slide here, I've included some additional resources, including references from earlier in the slide deck. I truly like the California Telehealth Resource Center Program Developer Kit. It has a number of pages that highlight key indicators to measure based on various service lines or domains. I've also linked a few examples of patient and provider surveys, how to create a framework to measure telehealth, and of course, quality improvement and evaluation in telemedicine. Thank you for taking the time to watch this video today. My contact information is on the slide should you have follow-up questions. Thank you.
This series of videos is presented to you by the National Consortium of Telehealth Resource Centers, the NCTRC. The NCTRC is funded through the U.S. Department of Health and Human Services, the Health Resources and Services Administration, and the Office for the Advancement of Telehealth. This map represents the NCTRC, which covers the whole United States and includes 12 regional TRCs and 2 national TRCs, which are the National Policy TRC and the Telehealth Technology Assessment Center. The TRCs have been in existence since the early 90s and were established to provide assistance, education, and information to organizations and individuals seeking information on providing healthcare at a distance. The NCTRC mission is to expand availability of healthcare to underserved populations through telehealth. For more information about telehealth, the NCTRC, one of the 2 national TRCs, or your regional telehealth resource center, please contact us through the NCTRC website. Thank you for joining us in reviewing this video series.